Mycoplasma was first discovered and isolated in 1898 by Albert Ludwig Sigismund Neisser and Friedrich Ludwig Wilhelm Goppert. They identified the organism in patients with pleuropneumonia, a disease affecting cattle. This initial discovery led to the identification of the first species of Mycoplasma, named Mycoplasma mycoides, which is known to cause bovine pleuropneumonia. The unique nature of Mycoplasma, particularly its lack of a cell wall, was not immediately understood. It was initially thought to be a form of virus or protozoa due to its small size and lack of a rigid cell structure. It wasn't until later in the 20th century that Mycoplasma was properly classified as a type of bacteria. The development of molecular biology techniques and advanced microscopy helped in understanding the true nature of these organisms. Mycoplasma infections, particularly those caused by Mycoplasma pneumoniae, which is one of the most common and well-studied species, are primarily spread through respiratory droplets. This means that the infection is transmitted from person to person via droplets in the air, which are expelled when an infected person coughs, sneezes, or talks. Here's a more detailed look at the transmission routes. Prolonged close contact with an infected person increases the risk of transmission. This is why Mycoplasma pneumoniae infections are often seen in crowded settings, such as schools, dormitories, and military barracks. When an infected person coughs or sneezes, they release tiny droplets containing the bacteria into the air. These droplets can be inhaled by others, leading to infection. Although less common, it's also possible for Mycoplasma to be transmitted through contact with surfaces contaminated with respiratory droplets. However, this is not considered a primary mode of transmission. Individuals who are infected but do not show symptoms can still spread the bacteria to others. Mycoplasma genitalium, another species of Mycoplasma, is primarily transmitted through sexual contact. It can cause infections of the urogenital tract. Prevention of Mycoplasma infections largely relies on standard infection control practices, such as good hand hygiene, covering the mouth and nose when coughing or sneezing, and avoiding close contact with people who are sick. Vaccines specifically for Mycoplasma pneumoniae are not currently available, so these preventive measures are especially important. Mycoplasma infections can present a variety of symptoms, which differ based on the specific type of Mycoplasma causing the infection. The most commonly encountered types in humans are Mycoplasma pneumoniae, affecting the respiratory system, and Mycoplasma genitalium, impacting the genitourinary tract. In the case of Mycoplasma pneumoniae, the infection typically manifests as a respiratory illness. Symptoms often develop gradually over several days to weeks and can range from mild to severe. Patients commonly experience a persistent dry cough, sore throat, fever, fatigue, headache, and muscle pain. In more severe cases, this bacterium can lead to pneumonia, bronchitis, or tracheobronchitis, characterized by more intense symptoms such as difficulty breathing, chest pain, and a high fever. On the other hand, Mycoplasma genitalium, a sexually transmitted infection, can affect both men and women. Interestingly, many individuals with this infection may not exhibit any symptoms. When symptoms do occur, men may experience urethritis, marked by a burning sensation during urination, discharge from the penis, or genital pain. Women might suffer from cervicitis or pelvic inflammatory disease, leading to abnormal vaginal discharge, bleeding after sexual intercourse, pelvic pain, and pain during urination. It's crucial to recognize that Mycoplasma infections can sometimes be asymptomatic, meaning individuals can carry and transmit the infection without showing any outward signs of illness. This is particularly common with Mycoplasma genitalium. Therefore, if there's a suspicion of a Mycoplasma infection, consulting a healthcare provider is essential for accurate diagnosis and appropriate treatment. Treatment typically involves antibiotics, but the specific choice depends on the Mycoplasma type and local antibiotic resistance patterns. Treating Mycoplasma infections generally involves the use of specific antibiotics, as these bacteria are sensitive to them, but the exact treatment can vary based on the type of Mycoplasma infection. For respiratory infections caused by Mycoplasma pneumoniae, commonly used antibiotics include macrolides like azithromycin or clarithromycin, tetracyclines such as doxycycline for adults, and fluoroquinolones like levofloxacin or moxifloxacin. The choice of antibiotic often depends on factors like the patient's age, medical history, and the prevalence of antibiotic resistance in the area. In addition to antibiotics, treatment for Mycoplasma pneumoniae also involves supportive care, which can include rest, staying hydrated, and using over-the-counter medications to reduce fever and alleviate pain. For Mycoplasma genitalium, a sexually transmitted infection, the treatment typically starts with antibiotics such as azithromycin or moxifloxacin. However, this bacterium has been increasingly showing resistance to certain antibiotics, making its treatment more challenging. In such cases, healthcare providers might adjust the treatment based on how the infection responds to the initial antibiotic therapy. An important aspect of treating Mycoplasma genitalium is the testing and treatment of sexual partners to prevent reinfection. Due to the growing issue of antibiotic resistance, it's crucial for patients to adhere strictly to the prescribed treatment plan and to complete the entire course of antibiotics, even if symptoms improve early. Follow-up testing might be recommended to ensure that the infection has been completely eradicated, especially in cases of Mycoplasma genitalium. For respiratory infections caused by Mycoplasma pneumoniae, preventive measures include standard infection control practices like good hand hygiene and avoiding close contact with those who are ill. In the case of Mycoplasma genitalium, practicing safe sex, including the use of condoms, is advised to prevent its spread. It's always important to seek advice from a healthcare provider for an accurate diagnosis and appropriate treatment plan if a Mycoplasma infection is suspected. Self-treatment with over-the-counter or previously prescribed antibiotics is not advisable, as this can contribute to antibiotic resistance and may not effectively treat the infection.